Sarah Hagel, and for the past year I have shadowed at Northside Forsyth Hospital through the Honors Mentorship Program. I was on three different floors. They were all med-surg. One was more cardiac, the other was pulmonary, and the last is surgical. And through that experience, I was able to learn more about nursing and the medical experience in general, and that's what I'm here to share with you guys today. We did have to form an essential question for this. And so mine is, how can personalized patient care and attention be used to provide better quality care? Because it's not about the quantity of care, it's about quality. You want to make sure that your quality of life is always going to be better when you leave the hospital. This question stems from my observations at Northside, but also an experience I had with a relative in the hospital. My grandmother was placed in the hospital with cancer for the second time last September. And for that time I was older and more able to analyze how they actually cared for her and why this was so important. And so this was the driving factor in understanding the importance of patient care and providing good quality. And so I had to interview some of the nurses that I talked to with, and I actually included some of their notes and quotes that we'll get to in a minute. But in general, through my research and my observations, I was able to come up with a three-part process that I think would work for the medical field, but also for any career in general. And the first step is to observe. For me, I was able to take vitals, blood pressure, temperature of patients, and it's very important that you observe symptoms and you don't overlook anything, because that can cause complications later. But it's not just observing. You also need to be able to react and think critically about what those results mean. And if they do mean something, you need to act on them. And if you do have to act on them, you need to be able to communicate well what it means to doctors. So if a patient has high blood pressure, you don't have to report every single thing to a doctor. You have to realize, is it important? What does this mean? Is this normal for the patient? If the patient just had physical therapy, then their blood pressure might be higher and it might not be a big deal. But if this just randomly happened and they're a cardiac patient, they might be going into cardiac arrest again. And so then you need to directly address the doctor. But you also need to address respiratory therapists, physical therapists, even the family and the patient themselves. And this is why having bedside manner is so important. I did find an article about insights on death and dying, which is actually common, shockingly, in the hospital. And it's very important that as a nurse or a healthcare professional, you're able to communicate this and other bad news well with the patient and the family. So that's very important. So once again, you gotta observe, be able to understand what's going on, critically think about what those observations mean, and then act on them by communicating to the right people. Aside from research, because I shadowed the entire year, that's where most of my knowledge comes from rather than articles. So I did include some quotes that pertain to the three-part process, and some don't. Some are just very interesting and profound. Things like preventing fragmented care with communication, that works with the communication I was just talking about. Because everything's so specialized now, you need to make sure that you're reaching who you need to reach to make sure that the patient gets the best quality care. And then there's some other, good life tips for any career in general, like trust your gut instinct, even if no one else believes you, because you know your patient best as the nurse, so you need to trust yourself, even if no one else does. Take care of yourself first. It is a very busy job. The medical professional in general is quite busy, and if you don't take care of yourself, you're not going to do your job well. You're not going to observe. You won't take as many actions. You won't be as proactive, and it'll be hard to communicate. An interesting thing is, I learned this just about a week ago, and it's very interesting, but the ICU is the intensive care unit, and most adults don't fully recover from it. There's always a deficit. If they make it to the ICU, then someone lower on the line messed up to some ability. They didn't observe, they didn't critically think, or they didn't communicate. When they get to the ICU, it's almost too late. Somebody messed up, and so that was really profound. A really good motto is, you're here to serve the patient, and that goes back to observations. You're here to do your job to make sure that you are giving them quality care. Documenting everything goes along with communication and critically thinking, because you need to make sure you know how the patient is progressing or if it's not progressing. If there's something wrong with your patient, this goes along with gut instinct. You need to make sure that you stick up for them. You need to be their advocate because they don't have an advocate. You are their advocate. And so I did do a vlog every single week just to summarize some of the things that I learned. But overall, it's very important to observe, to make sure that you're aware of everything that comes with knowledge and practice and experience, which I got from shadowing through Northside. It's also important that you act proactively and critically think about what those observations mean. And finally, you need to be able to communicate with doctors and therapists and the patient and the family themselves respectfully and professionally. All right, thank you.